Your baby just finished feeding, and for the umpteenth time, they've spit up all over your shirt, your shoulders, maybe even the couch. And you're wondering, is my baby normal? Should I go to the ER? Should I call my doctor? What should I do? In this episode, I'll be teaching you about reflux in infants, when you should be worried, if it's normal, when it's not, and what to do either way. So let's go. Welcome to the Dr. Amaka Nnamani show, where we emphasize preparation over perfection. If this is your first time, welcome. I'd love to have you here. Be sure to subscribe and like and share with a mom or two in your life or in a group that you think that this video will benefit. So let's get right into it. So like we just talked about, we're going to be talking about reflux. So what is reflux? Reflux basically simply means it's a situation when the stomach contents go from your child's stomach, or not really just necessarily your child, just a person's stomach, back into the esophagus, and usually sometimes out the mouth. So it's usually stomach contents. In cases of infants, it usually is the milk, right? Because the first 6 months of life, that's what your baby is dependent on and is feeding on. Now, most of the time it's normal. Actually, up to 40% of babies will spit up. It usually happens sometime right around the 2 to 3 week mark, and usually peaks around about 4 months of life. So importantly, sometimes things can actually get worse before they get better. Now, why do babies get it? They get it because the muscle in the lower esophageal sphincter, or just the muscle at the bottom of the esophagus or the food pipe, is still developing, right? So as your baby gets older, that muscle gets stronger, and actually eventually by age 12 months, a lot of times it actually does resolve. So when is it normal? So we just talked about how it starts right between the 2 to 3 week mark and then peaks around the 4 month mark, right? So there's something we call happy spitters. So what's a happy spitter? Most babies actually are happy spitters. So happy spitters are babies who spit up. It might be a little, it might be a lot, but right after, they're fine. They're ready for their next feed, and they go about their lives like nothing ever happened. And as a mom, you're wondering, oh my gosh, I just fed you and you just spit that up and you're over there smiling. Again, it's usually all normal. So that's what we would call neonatal gastroesophageal reflux, right? So things, babies who are happy spitters, usually they're not fussy a lot of times. Again, they just spit up and then they're fine. They are not losing weight. They're not dehydrated. They're just what we call happy spitters. Okay, and we'll talk about things to do with your baby that's a happy spitter. And then we have what we call gastroesophageal reflux disease. So there's GER, which is gastroesophageal reflux, and then there's GERD, which is gastroesophageal reflux disease. Now, this is usually typically, a lot of times that's not normal. Now, with babies who are happy spitters, they can actually spit up a lot of times in a day. Some studies show 20 to 30 times a day. Yeah, it sounds crazy. So if you have a happy spitter, you actually have more of a laundry problem, so hang in there, versus like a medical issue, right? Now, for babies who have gastroesophageal reflux disease, a few things that you will see is when your baby's beginning to refuse feed, so they're averse to their formula or their breast milk, they are arching their back, so that's a significant sign of pain, right? So when they're arching their back and therefore they're not wanting to feed. And very importantly, because they're not feeding as much, again, obviously they're losing weight, but because they're not feeding as much, they may start to have less wet diapers, right? So you want your baby to make at least 4 to 5, close to 5 wet diapers in a 24-hour period. Anything less than that really should warrant a visit to your pediatrician. So other red flags to watch out for that are not necessarily related to GERD or gastroesophageal reflux disease are when your baby is having like a greenish spit up. That is usually indicative of some kind of what we call bilious vomiting. That's never normal. So we usually want to make sure that gets checked out. Now, I want to put a caveat there. So if your baby is spitting up greenish stuff, usually I want you to go see your doctor. Okay. But in babies who are breastfed, now babies who are breastfed are eating pretty much everything that mommy's eating. So mom had like a whole lot of spinach and broccoli and all of that stuff. That may show up in their spit up or in their poop, right? But in general, bilious spit up is never normal. Red, vomiting red, like, having blood in the vomitus is usually not normal. Now, another slight caveat with that is babies who are breastfed, if mom has a cracked nipple and maybe baby was feeding and it got bloody, you can see that in breastfed babies. So breastfed babies, importantly, their diet is really what mom's eating. So I usually always say, try to get a history of what you may have just eaten or what's going on with mom's body, because usually that will affect your baby. Okay, so you don't want to have bilious vomiting. You don't want to have reddish, blood in the vomit. You certainly don't want to have your baby not making at least 4 to 5 wet diapers. These things would really warrant you seeing your doctor. Obviously, if there's associated symptoms like fever or lethargy, so your baby is really just not acting like themselves, that would also be another reason to see your doctor. Okay. And now what can you do at home in the meantime for, your baby who's generally a happy spitter, right? So, either way, most times I usually recommend you see your pediatrician, but, for babies, a lot of times because your baby has an all liquid diet, and we talked about how that muscle of the lower esophageal sphincter is still not well developed, we a lot of times will actually thicken the formula or the breast milk, or the feed. So a lot of times it happens if the thickening of the feeds happen more often with babies who are formula fed, but we can also recommend it for babies who are breastfed. So if you're a mom who's exclusively nursing, we may say that you should pump into a bottle, and then bottle feed the baby sometimes. But even before that, a few other things we recommend are reflux precautions. So what does that mean? That means keeping your baby in an upright position for at least 20 to 30 minutes after a feed. So you usually don't want them laying down flat right after a feed, because that increases their chances of them vomiting right back up. We also usually want to have you then sometimes thickening your feeds, but usually talk to your pediatrician so that you know the mixture and how to go about it. Here in the US, we usually use oatmeal cereal, and I typically don't recommend rice cereal for several reasons, because some studies have showed that rice cereal has high arsenic levels. So I typically don't recommend rice cereal. I usually go with oatmeal cereal, and you can also, depending for babies who are breastfed, we may find, especially if it's happening earlier on, just kind of doing an elimination diet in mom. So some babies may be dairy sensitive. And so with mom cutting lactose up from her diet, it may actually help. And depending on other associated symptoms, your baby may eventually need some kind of highly sensitized or hypoallergenic formula. Now, with regards to sleep, it's really important that you don't put your baby to sleep in like a sleeper or like a car seat, right? Because there are lots of injury concerns related to that. You still want to have your baby back to sleep, right? Because we know studies have shown that the gag reflex actually will protect your child. The more important things to actually focus on are those reflux precautions. The other thing I forgot to mention was also just making sure that not only are you, with the thickening of the feeds, but also that you are kind of reducing the volume of the formula that you're giving your baby at one time. So if you're giving, or breast milk, I always forget with breast milk, a lot of moms are directly nursing. But for instance, if you're directly nursing and you're nursing for 20, 30 minutes at a time, you may want to cut to like 10 minutes at a time, let your baby burp, and then do the last 10 minutes. If you're formula feeding, then you usually want to, if your baby, let's say, is taking a 6-ounce bottle, you may want to give them 2 to 3 ounces, burp them first, let them kind of chill for 10 minutes, and then give them the last 2 or 3 ounces, right? So those are all important things to remember Very importantly, another red flag that you want to watch out for, especially in the first month of life, is if your baby is projectile vomiting. So projectile vomiting, I always want to make sure we understand what that is, because I've had a lot of moms tell me, yes, it was projectile, and it actually really isn't. So projectile is actually at an angle, right? So if someone's standing a few feet from you, like it's literally projecting that way. It's not just the spit up that's, all over your shirt or the baby outfit, but it's literally like kind of almost going across, right? That's never a good sign, especially in the first month of life. You definitely want to see your pediatrician, and a lot of times your pediatrician will probably order an abdominal ultrasound to make sure that your baby is normal. So basically things that you want to look out for when you want to see the doctor is if your baby is not making at least 4 to 5 wet diapers, you're seeing that greenish yellowish vomiting and or vomiting in the spit up, your baby is losing weight, right? So that's something that your pediatrician will be able to track to say, oh, wow, we saw him a month ago and he's actually lost weight from the last time. Those are important things to remember. Now, most babies will actually outgrow the reflux by 12 months of life, right? So any reflux that starts after 6 months usually should be worked up, because it happens, like I said earlier, it starts in the first 2 to 3 weeks of life, peaks around 4 months, and then should resolve by 12 months. So if your baby's been fine for the first 6 months and just starting with reflux, you definitely want to have your pediatrician check it out. Now, the big question, a lot of moms probably come into my office kind of ready for medicine, right? Is, so when does my baby need medicine? Now, importantly, it's really important that you trust your pediatrician here, but I do want to say, for babies who are happy spitters, medicine actually almost never works. Those reflux precautions are more important. Medicine becomes really relevant, right? Where you have your anti-reflux medicines become more important when your baby's arching their back, refusing to feed, losing weight. And so when we start that medicine, then that helps with the acid production and reduction of that reflux. So again, talk to your pediatrician about that. If you have a baby who's premature, that may increase their risk. Also, secondhand smoke exposure does increase that risk. So if you are a smoker, if you have someone in your house that's a smoker, it's probably a good time to quit. Okay, always a good time to quit smoking, but especially then. So I hope this video was helpful. I want to hear in the comments what questions you have, how this was helpful, what an aha moment for you. But until then, remember, preparation over perfection. Hang in there. You're doing a great job. You may have to do a lot of laundry, but you will get past this. Okay. All right. Well, until the next one, I'll see you. Take care. Bye.